Hi, I'm Dick Oles. I'm actually the founding dean of the UCR School of Medicine. And in addition, I'm an infectious disease specialist. So I have the unique perspective of having cared for patients with HIV/AIDS from the very beginning of the epidemic to today. And I can tell you how wonderful that transformation has been from a disease that was a several-month death sentence to a disease that today is eminently treatable. But the key thing now is to find everyone who has HIV infection early and before they have symptoms. There's every reason in the world to find those individuals, since with effective treatment, people are much less likely to transmit the disease. They also have a longer life expectancy and less health problems. Now, unfortunately, in this country, 1 out of every 5 people don't know they have HIV/AIDS. That's the whole reason behind voluntary testing of every individual. I would encourage all of you to get tested for HIV, as I have been over the years. Knowing that you have this infection is the first step in basically treatment and blocking transmission.
David and I are genuinely honored to speak with you today as representatives of this much larger group. We are 50 and growing, including healthcare agencies, elected officials, municipalities, and faith-based organizations, educational institutions, businesses, and foundations.
Over the past year and a half, our coalition has conducted research. We've held think tanks and design sessions. We've planned and we've prepared. Today we are ready and we are proud to introduce this campaign to the community. Our community coalition will be working hard to greatly expand the number of HIV testing sites in the Valley and to bring HIV testing to hundreds of community events over the next 3 years.
So I am enormously proud to announce today that individual members of the Desert AIDS Project's Board of Directors have made personal financial contributions totaling $500,000 to this campaign.
The prevalence of HIV in the Coachella Valley is about twice as high, more than twice as high, the U.S. average. And 70% of the people that live in this county have never had their HIV status tested. Think of this, if you will, like screening for breast cancer or colon cancer. The reason that we do that is to discover those conditions early, because both survival and outcomes are greatly improved by the knowledge that they have that infection.
As a congressman, physician, and resident of the Coachella Valley, I'm strongly committed to the health of our community and proud to be a champion for the Get Tested Coachella Valley campaign. The HIV epidemic has been with us for over 30 years now, but it doesn't need to stay with us forever. We have the tests, we have the medicines. All we need now is the community will. If we succeed here, we have the opportunity to make our program and our success a model for the entire nation.
We are so excited to be the lead sponsor for Get Tested Coachella Valley and also one of the 50 partners. It is so important that citizens in our community in the Coachella Valley find out their HIV status. If they are negative, we'll want to make sure they stay that way, but if they're positive, that they will not continue to infect others as well as get the treatment that they need.
Even if you don't think that you may be positive, it's important to get the information. Knowledge is power. If you know you're negative, you're more likely to stay negative, and if you're positive, you can take action.
We are now on the cusp of the next major development in the care of HIV patients, and that is to identify them when they have no idea that they are HIV positive. There are hundreds of people here in the Coachella Valley who are right now HIV positive. You may be one of them and have no idea that you are. This is the best thing to happen in the world of HIV/AIDS in the Coachella Valley, perhaps ever, and I'm asking you to participate. Thank you.